In this video, we will discuss 10 ways EMS providers can prepare for mental health responses. Given the rise in violence towards first responders, and recognizing that paramedics play a critical role when responding to mental health crises, we aim to share 10 tips for safe and effective mental health responses. Welcome back to our EMS Incident Command channel. We are delighted to have the opportunity to discuss relevant EMS and leadership topics with fellow EMS professionals week after week. Please let us know in the comments how we are doing and if there is a topic you'd like us to discuss. All our videos are fact-checked by industry leaders and made by experienced paramedic leaders working in the field. As EMS providers, mental health is a large part of our emergency medical response. These types of calls don't always come as a mental health crisis. At times, they come in as a medical response. As first responders, we understand that every call has a mental health perspective in some way or another, whether it is helping someone through their illness, anxiety, or depression, or helping their family cope with the situation. Mental health crisis is a growing epidemic within our society and communities. As first responders, we should want to gather more knowledge and understanding on how to manage these situations effectively. Recognizing that first responders play a critical role when responding to mental health crises. Here are 10 essential things we should know when dealing with a mental health crisis. Number 1. Recognize the signs. EMS professionals should have increased training to recognize the signs and symptoms of mental health crises, including depression, anxiety, psychosis, suicidal ideation, and aggressive behavior. There are many signs and symptoms of mental disease. Keeping ourselves up to date with continued education and experience will help you develop the best techniques for you. Number 2. Safety first. Ensure the safety of yourself and your partner, the patient, and their family. Assess the scene for potential dangers and take appropriate precautions to prevent harm to anyone involved. Include law enforcement when you feel it is needed, and never put yourself in a dangerous situation. Unfortunately, these are the types of calls that can sometimes cause harm to EMS professionals as well as patients. Safety is always our priority. Number 3. De-escalation techniques. Learn and practice de-escalation techniques to diffuse tense situations. This type of technique includes using calming language, keeping your voice neutral and keeping emotions out of your voice, maintaining a non-confrontational demeanor, avoiding touching the person, and giving the individual space when needed. Give your full attention, nod, ask questions, and avoid changing the subject or interrupting. At times, we might want to steer them into a different conversation if the one they are on is making them more agitated. This call can take a few minutes longer than we are used to giving, but can be crucial in a situation. Let the patient feel like they are a part of the solution and not the problem. Number 4. Active listening. Active listening is crucial in understanding the person's perspective and feelings. EMS professionals should listen attentively, show empathy, and avoid making judgments or assumptions. Reassure the patient that you are paying attention by repeating what they have told you. The patient will realize that you genuinely listen and care about their situation. Acknowledge their feelings. Number 5. Assessment. Conduct a thorough mental health assessment to understand the severity of the crisis, the person's risk level, and any immediate safety concerns. Assess for signs of self-harm or harm to others. By listening, you can hear the cues of possible injury to themselves or others. Are they feeling unsafe in their environment? When the family is present, remember to listen to them. Separating the parties in these situations can be complicated, but privacy is essential. Remember to involve law enforcement to help de-escalate situations and for safety. Number 6. Verbal communication. Use clear, concise, and non-judgmental language when communicating with the individual. Avoid aggressive or provocative statements, and be empathetic in your interactions. Please do not lie to the patient about what steps might be taken for their safety. When this happens, you will not only lose the trust of the patient but then lose the trust of any other first responder who will come in contact with them after that and try to help them. Number 7. Stay calm. Maintain a calm and composed demeanor even in challenging situations. Your calmness can have a soothing effect on the person in crisis. Becoming angry or bothered will only cause more harm to the problem. Everyone has situations in life, and today, you could be the only hand of comfort this person might encounter. Number 8. Patient-centered care. Involve the individual in their care decisions to the extent possible. Respect their autonomy and preferences, and discuss treatment options collaboratively. Always let the patient be a part of their situation. Let the patient know the choices and help them feel like they are a part of every step. Remember that giving them a choice helps them feel like they have some control of the situation, which helps with a smoother interaction. Number 9. Resource awareness. Know local mental health resources, crisis hotlines, and facilities where individuals can receive appropriate care. Provide information to the individual and their family, if applicable. Number 10. Documentation. Accurate documentation of the mental health assessment, actions taken, and observations made is essential. This documentation helps ensure continuity of care and can be crucial for follow-up treatment. Make sure to write if they have thoughts or plans of hurting themselves or others. Communicate information with staff at the facility to help the patient acquire the proper help they will need. Additionally, first responders should receive specialized training in mental health response, including Crisis Intervention Team, CIT, training if available in their region. This training equips paramedics with the knowledge and skills to handle mental health crises effectively and compassionately. Remember that every situation is unique, and first responders should adapt their approach based on the individual's needs and the specific circumstances of the crisis. Collaboration with mental health professionals and law enforcement, when necessary, can also enhance the overall response to mental health emergencies. This, in turn, will help in gaining a better understanding when working with different entities. Don't forget, if there are any other topics you would like us to discuss or any information you'd like to share, leave it in the comments or email us the address in the description. Thank you very much for watching. See you out there.